Private community hospitals have all but disappeared from the South Los Angeles area. It's even hard to picture that at the corner of Western and Manchester Avenues, there were once plans to build a massive medical and retail center for the greater Southwest Los Angeles community. This large development was the Morningside Hospital. Yet today, the only clue that the hospital even existed is the sign of a hidden pharmacy namesake that sits just a few steps from the intersection. So what happened to the Morningside Hospital and those planned retail developments? And how did community hospitals like this that once speckled South Los Angeles just disappear? In the mid-1950s, there were elaborate plans for 10 acres of land at the southeast corner of Manchester and Western Avenues. The Morningside Hospital Corporation planned to build an 86-bed general hospital along with a 2-story medical office building, restaurants, retail stores, and a gas station. In total, the new construction was anticipated to cost as much as $3 million, with the hospital costing nearly $1 million on its own. The acreage and the buildings were owned by Harvard Properties, and the hospital was leased to the Morningside Corporation. In a city like Los Angeles, it's hard to think about its rural beginnings, especially in a place as urban as the west side of South Los Angeles. In a 1969 interview with the Daily Breeze, Olga Sharp, the long-serving secretary for the Morningside Hospital, described the development area initially as a rural area with truck gardens and farms, fenced in with 2 airports where single-engine planes buzzed by the stubble field that is now Morningside Hospital. The planned hospital, which only occupied a quarter of the 10 acres, would be a 1-story building that was equipped with a surgical suite, 4 operating rooms, and a recovery room. On the basement level of the hospital housed a laundry area and a morgue. The Morningside Hospital was one of 7 hospitals being built in the southwest Los Angeles area around 1956. A rapid rise in post-war population resulted in a critical shortage of hospital beds, and Morningside and the 6 other hospitals would add a total of 500 hospital beds to Los Angeles. Morningside Hospital opened in March of 1958 with a staff of over 240 physicians, and later expanded to house an emergency department in October of 1958. For 2 years, the hospital underwent rolling development until it didn't. In 1960, the California Christian Foundation acquired the Morningside Hospital and Manchester Hospital, the second transaction for a Christian foundation acquiring a private hospital at the time. The California Christian Foundation consisted of leading members of the Church of Christ and Pepperdine College, which was also affiliated with the Church of Christ. After the acquisition, Morningside Hospital was aptly named Morningside Christian Hospital. There was no monetary exchange during the acquisition, but instead, the church was solely responsible for paying off $600,000 in stocks and equipment. In a 1960s Los Angeles Times article, the executive director of Morningside Hospital said, "We haven't been losing money, but we haven't been making any," suggesting the dire need for the hospital beds in the Southwest community wasn't justifying a $3 million development. This also meant the plans to add a retail development and a gas station were canned once the hospital changed hands to the foundation. Yet, only a year later in 1961, the Morningside Hospital merged with the Lutheran Hospital Society of Southern California, another newly formed charitable foundation. When I initially started this research, I found it odd that this new development could decline so quickly and need to be sustained by a religious foundation. But later, it became apparent that the medical insurance and neighborhood demographics began to shift. In 1965, California jump-started its own state insurance program to provide extended medical coverage to low-income individuals and persons over 65 years old. While before this time period, these individuals would be relegated to the county public hospitals, the coverage allowed them to seek care at private institutions such as Morningside Hospital. During this time, the Los Angeles Times reported that Morningside Hospital had a 30% increase in patients since the inception of the program. This increase in patients put more strain on the hospital to hire more physicians and staff to keep up with the increased care volume. Now, in the mid-60s, we're seeing a pivotal shift of community hospitals in urban areas serving middle to high-income individuals to a higher volume of low-income individuals through the spread of government-sponsored insurance plans. And while increased volume would appear to be a benefit for the hospital, like a diner getting more customers, it's not, and it's a lot more complicated than that. Prices for hospital services are typically negotiated differently with government-sponsored insurance plans, costing less than what private insurance would generally charge. So in the case of this diner that we're talking about, imagine an influx of customers where some customers are paying less than others for the same product. Even though the volume is there, the bottom line might not be met. But the impact of Medicare wasn't immediate. In fact, the medical facility continued to expand and excel. Morningside Hospital also took on emergency service contracts for Los Angeles County when it opened, and by 1967, the hospital was the sole private community hospital in the Southwest to provide emergency hospital services after the Bon Air and Broadway hospitals ceased their emergency service contracts. Again, here we're seeing an increased strain on a community hospital, accommodating for a larger patient size and increased pool of emergency services. With an increase in emergency cases and an opportunity to capitalize on it, Morningside Hospital began expanding and renovating its emergency department. In 1968, the 536 square foot emergency facility at Morningside treated more than 2,000 patients monthly through its emergency services. In this new renovation, the medical center would add 2,000 additional square feet to its emergency room. Morningside Hospital continued to serve the greater Southwest Los Angeles community throughout the decade, easily securing its accreditation and even expanding its pediatrics department. But in 1980, Morningside Hospital announced its plans to close because of the inadequacies in governmental reimbursements for care and growing competition. The Daily Breeze reported how the Morningside Hospital's bed count utilization dropped to 36%. And roughly 83% of patients had their medical care paid by county, state, or federal agencies. And the hospital's low patient load could not cover the cost of providing care that was being paid for by government-subsidized insurance plans. I want to take a moment to revisit the same Daily Breeze article I shared at the start of this story, where Olga Sharp described the hospital as a stubble field. She mentioned this when reflecting on her contributions in building the hospital. I remember the night before we opened. Everything was prepared, all had been inspected for the last time. I turned off the lights, locked the door, and walked to my car. As I look back, I thought this would probably be the last time the hospital would be like this, locked and without a light burning. I was right. By September of 1984, the hospital was listed for sale, left abandoned in 1987, and demolished in July of 2002. The Harvard Yard and Glenmary Apartments for seniors, which were built around 2005, now stands in the place of this demolished hospital. The story of the Morningside Hospital is eerily similar to other community hospitals that closed in South LA around the 1980s. The Broadway Hospital, the South Hoover Hospital, the Bon Air Hospital, and several other community hospitals all closed in the very early 1980s. But why? I reached out to Alan Sager, professor of health, law, policy, and management at Boston University School of Public Health, and he had studied the competitiveness of hospitals between 1937 and 1980, and the common closures of small community hospitals that occurred across large cities in the United States around the 1980s. Sager found that community hospitals in low-income areas had a common characteristic of financial distress due to a higher mix of patients who used Medicaid or were uninsured. Additionally, Sager posits that larger teaching hospitals began to become more abundant and delivered a higher volume of care, especially by the 1980s. For South Los Angeles, Martin Luther King Jr. Drew Medical Center, a public teaching hospital built in 1972, sourced several physicians from the Charles R. Drew University of Medicine and Science in Willowbrook. Teaching hospitals like King Drew had the capacity to subsidize the care of uninsured and underinsured patients, and also had more funding pathways and reserves. And this is just one of several teaching hospitals in the Los Angeles area. At the same time, according to Sager, physicians who had originally gone into private practice, say Dr. Pilson from the South Hoover Hospital, had begun to retire or in other cases relocate when the demographics changed. Larger teaching hospitals had the ability to retain staff on salaried positions and attract resident physicians. Larger hospitals are also more anchored in the community and because of their size are less likely to move because of demographic changes. Simply put, community hospitals had a tough time surviving when the healthcare model benefited larger organizations. And even though the Christian foundations that sought to save these hospitals in Morningside in the 1960s tried, they couldn't sustain the demographic shift and the loss of revenue. While the Morningside Hospital's era has come to an end, it's interesting to reflect on what the area has become today. In fact, everything the Morningside Corporation dreamed of when it developed those 10 acres of land at the intersection of Manchester and Western Avenues has come into fruition if you look closely enough. Just down the street, the Kaiser South Los Angeles Medical Building provides outpatient care to the nearby community. There's a Ralph's gas station that fulfills the dream of the intersection having a gas station right on Manchester and Western. And the namesake Morningside Pharmacy, which was filed with the Secretary of State in 2008, likely in recognition of the former pharmacy, is hidden in plain view, but it signifies the hospital once existed. So, in a sense, when Olga Sharp said the hospital would be without a light burning, she was right. The story of the hospital continues to live on in small Easter eggs near the intersection of Manchester and Western Avenue in Gramercy Park. But the question in South LA always remains the same. How will things change next?